is Medicare? Let's just start there. National Insurance Program for those 65 and older. It's administered by CMS. CMS is the Center for Medicare and Medicaid Services. And then you enroll through the Social Security website, ssa.gov. Okay, that's where you enroll for Medicare. All right. Who's eligible? Well, everyone over 65, all U.S. citizens, of course, and then legal residents who've lived in the country, lived in the U.S., continuously for at least the last 5 years. And then some people under 65, if they're eligible for what's called SSDI, Social Security Disability Income Benefits. Okay, that is something that everyone should be aware of. Okay, there are only 4 parts to Medicare. I've had people tell me, well, there's so many parts to Medicare. There's only 4. There's only 4. It's A, B, C, and D. Very, very straightforward. And if you look at my little line underneath here, let me just show you here. So Part A and B provided by Medicare. So what does that mean? Well, do you know that 1.45% you pay out of your paycheck? Well, that's what this is going towards. That 1.45% you pay is going to your Part A and Part B coverage. Part A is hospital coverage. Part B is doctor coverage. And then you get into the right side of the chart, Part C and D. Look what I have under there. Provided by private insurance companies that contract with Medicare. Remember, I talked about that. There are 3 areas where private carriers are involved. This chart depicts 2 of them, Part C and Part D. Part C is called Medicare Advantage. Part D is prescription drug coverage. Okay, that's the 4 parts of Medicare. How do you enroll in Medicare? Well, I stole this page out of a book called Medicare and You. And anyone could ask for this book. By the way, they're in our libraries if you just want to go into the library. It's called Medicare and You 2024. Last year, the book was called Medicare and You 2023. So every year they come out with the book and they do all the updates for the current program. That's how it works. There's only 2 ways to sign up for Medicare, 2 options. I've laid them out here. Option 1. Okay. Option 1 is called Original Medicare. And what you do there, you sign up for Part A and Part B. You select a prescription drug plan that matches up with what you need. And then you get a Medigap or a supplemental policy to cover the 20% that Medicare doesn't cover. Option 2 is you sign up via Medicare Advantage. You do not do both of these. You do one or the other. Medicare Advantage has Part A and B. It'll also usually have a prescription drug plan pre-negotiated into the program. So it's kind of, they bundle all the services together. In addition, Medicare Advantage may have a dental plan attached to it, as well as a vision plan attached to it. On my original Medicare, the option 1 side, vision and dental are a la carte. You must go find programs that cover your vision and your dental. Okay, so that's kind of a side-by-side on the 2 options you have on how to sign up for Medicare. Okay, we can get in a whole discussion about which one is better, but I can tell you about 95% of my clients sign up via option 1. Option 2 becomes is getting more and more popular. However, option 1 is the one most of my clients select, and I'll tell you why. I think it's really because of freedom of choice, where they can go to any specialist in the country that basically takes Medicare. Whereas the way the Advantage programs work is that they've pre-negotiated the doctors and hospitals that you can go see. So there's more of a limited choice there of the entities you can go visit with, whereas Original Medicare does not have that constraint. So I think that may be a big part of why people go with Original Medicare, at least in the experience I have had with working with clients on this. All right. How do you enroll in Medicare? Well, as in anything else, it's not simple. If you are receiving Social Security when you turn 65, which you could be, because Social Security you could start at age 62 if you wished. But if you are receiving Social Security benefits when you turn 65, Medicare Part A and B are automatic. You can decline if you don't want Part B. Why would you decline Part B? Well, if you're still working and you're a special enrollee, i.e. you're working with you're in a company of 20 more people, you wouldn't want to take Part B because you're already paying healthcare coverage from your employer. If you take Part B, there's a premium that's charged with Part B. You'd essentially be double paying. Part A you could take if you elected to, because Part A doesn't have a premium per month. Now, the one caution I would give you, if you do sign up for Part A and you're participating in a high deductible health plan with a health savings account, an HSA, well, you're not allowed to participate anymore in the HSA if you're on any aspect of Medicare, including Part A hospitalization. So just be aware of that. If you're on a prescription, if you're on any part of Medicare and you wish to participate in your HSA, you cannot. You must stop the HSA. So in that case, you'd want to decline having both Part A and Part B to allow you to continue to contribute into your HSA. Okay, the coverage starts the month you turn 65. So if your birthday is June 7th in a given year and you're turning 65 on June 7th, well, Medicare would start on June 1 for you. Part C and D are not automatic. Now think about that. Part C and D are a private insurance company. They don't know about you. A and B come from the government. They know your age. They know who you are, especially if you're already on the system, the Social Security system. Part C and D are not automatic then. You'd have to say something if you want to have a Medicare Advantage coverage or a prescription drug coverage. You need to say something. Okay. All right. So continuing on. So that first chart, let me just go back just to emphasize. So if you are receiving Social Security now, I'm going to talk about if you are not receiving Social Security when you turn 65, because remember, you can let your Social Security continue to bake and take it at age 70 and get delayed credits. Okay, there's a whole Social Security presentation I do on strategizing around Social Security. So if you are not receiving Social Security, you must sign up through the Social Security Administration website during the Medicare enrollment period. Now, what is the Medicare enrollment period? This is huge. This chart is a big deal. The Medicare enrollment period has 3 different periods of time that, depending on your situation, you would need to adhere to that enrollment period. Okay, so first is the initial enrollment period. If you're not covered by a group plan at age 65, that's you. So that would be me. So if I turn 65, I would be in the initial enrollment period. I have to sign up. Then you have the special enrollment period. That's for people if you're covered by a group plan at 65 and you don't sign up for Medicare, you're then in the special enrollment period. And then you have the general enrollment period. And that's essentially if you missed one of the first 2, then you get into the general period. So let's go into a little bit more detail on this. So when your coverage starts, well, if you sign up before the month you turn 65, coverage will start the month you turn 65. So this is kind of a little bit of a delay. So if you sign up 1 month after you turn 65, it starts the next month. So let me just go back and tell you that when you're in the initial enrollment period, there are 7 months that they give you to sign up. So, so don't be concerned that I only have 48 hours to do this. That's not the case. So it's 7 months. So let's just pick on, a June birthday again. So if your birthday is in June, you can sign up in March, April, or May. And if you sign up in March, April, or May, those 3 months, well, then your coverage starts on June 1. But you could also sign up in June. You could sign up in July. You could sign up in August or September. And if you sign up in the last 3 months, so it's a 3 months prior, the month of your birthday, and 3 months after, if you sign up in that 7-month window, you're not considered late. You're not considered late. However, if you sign up in June, and your birthday's in June, then your coverage is not going to start until July 1. That's what they mean the next month. That's what they mean by that. Okay, that's how that works. Okay, so who signs up for Part A during the initial enrollment period? Well, almost everybody. Check with your benefits administrator if you're still working and covered by a large group plan. You may be advised to enroll in Medicare Part A to enhance hospital coverage offered by an employer. However, and this is the point, I was a couple of charts ahead. Sorry about that. This is the point I was making earlier. Do not sign up for Part A if you have a high deductible health plan where you're participating in an HSA, because HSA contributions must stop if you're going to get Medicare. Okay, they must stop. That's the rules. Okay, all right. Who signs up for Part B during the initial enrollment period? Well, people who are not covered by a comprehensive employer-sponsored group plan that covers 20 or more people. So, who's that? Well, if you're not working, if you're self-employed, if you're employed by a company with less than 20 people, if you're on COBRA, that was what I talked about before, very important. If you're receiving retiree health care benefits, wonderful that you have retiree health care benefits, but once you turn 65, you have to switch. Medicare has to get signed up for, that becomes your primary. Your retiree health care benefits can serve as your supplemental policy, okay? That 20% I was talking about that Medicare doesn't, Part B doesn't pay, your retiree health care coverage could cover that, okay? And you're employed by a company whose health plan is less comprehensive than that which Medicare provides. All right. So, who signs up for Part D in the initial enrollment period? Well, people who signed up for Part A and B who want prescription drug coverage either now or in the future. I know that that's what that says, but I would be a little firmer on that. I would say you want to go get a prescription drug plan straight away, because if you wait, you'll pay a penalty for signing up late to get it. In fact, I even said that you must sign up when you're first eligible or face late enrollment penalties unless covered by a group plan that's as comprehensive as Medicare. That's called credible coverage. How do you know if you have credible coverage? You have to ask your employer. You have to ask your employer. And the words that you would ask are, in the eyes of Medicare, is the group coverage plan we get as prescription drug plan, is that credible in the eyes of Medicare? That's what you ask them. Two options for Part D. One, you can get a standalone prescription drug plan. So that's if you sign up with original Medicare. Or if you go through Medicare Advantage, the prescription drugs are normally included in that program. That's how you get a prescription drug plan. I will say this also. So where you sign up for a prescription drug plan, if you're doing the standalone plan, you would go onto Medicare.gov, and they have a neat program in there. And yes, I did give a compliment to the federal government. They did a nice job on this. And what you do is you put in the medications you're on, the frequency you take them, the dosage you take, and the pharmacy you like to use. And the system will come back and it'll tell you the best plan in your for those drugs. This is going to be the best plan for you. The reason I say to kind of do that reverse engineering is because the best prescription drug plan for you may not be the plan that costs the least premium. The plan that is best for you is the one that treats your medications in the most favorable economic manner. In addition, the plan that your wife is on may not be the same plan that you go on if you're both turning 65, because she may be on no medications, you may be on a couple, she may go on one program, you may go on a separate. So just be aware that that's the best way to go determine what prescription drug plan might be best for you. Okay.